and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, man, we're super excited to have you here because we've just got some incredible conversations with some fantastic leaders that are painstakingly reshaping the future of healthcare. So we happen to be really passionate about a few areas. We're passionate about innovation, access, leadership, and adoption of things. And if it's your first time tuning in, let me just kind of pull back the curtains a little bit and tell you a little bit more about what we're doing here. So our focus is bringing real stories of innovation inside of healthcare to life. The aim is highlighting, real people that are truly innovating within our space and giving them the platform to share their stories with our community and ultimately with the world. So we've got an action packed here. We have just amazing people that are slated to come on. So if you haven't checked out any of the historical interviews, wherever you are, if you're watching this, if you're listening to this, just hit the subscribe button now so that any of the new interviews come to you directly. So every so often, somebody comes along who reminds us that innovation in healthcare isn't just about technology. It's about people, a purpose, and most importantly, the courage to take a different path. So our guest today, Dr. Matt Cybulsky, has built a career on exactly that. He's a co-founder of Tessellate, a platform designed to put physicians back in the driver's seat of their careers. At a time when so many clinicians feel like they're, caught up in the system, Matt's vision is very simple and yet very powerful. Give physicians clarity, give them choice, and give them back their voice. So he's an entrepreneur, and more importantly, I view him as he's like a guide, So through his work at Tessellate and his leadership at Ionian, Matt's been helping healthcare teams see what's possible when design with empathy and leading with data come together. So there's something else that says a lot about Matt at his core. He's an Eagle Scout. So the foundation of service, discipline, integrity, it shows up in how he builds, how he leads, and honestly, how he shows up for people around him. So Matt's been on some of the biggest stages in healthcare, HIMSS, Oracle, you name it. However, today we get to sit down, we get to slow down, we get to hear a bit of the story behind the work. So Matt, it's great to see you. Welcome to the show.
Michael, great introduction. Proud of all those things. And you're right, the Eagle Scout part of my history gave me a leg up in a way that I
Yeah.
didn't recognize. But, guide or guy, one of the things I see with myself is sitting with peers and constantly learning.
Mm.
And if there's any industry that's going to humble you with the intelligence around you, it's going to be healthcare.
Yeah,
There
yeah.
are smart, capable people that I've been able to interact with and keep me on my toes. That's for sure.
Yeah, so listen, so you've been able to kind of bridge all these things together, right? Like before we dig into this stuff, I mean,
Sure.
you're talking empathy, service, innovation, and
Yeah.
before we dig into Tessellate, I mean, when did that sort of that concoction, that mix of psychology and service first start to kind of shape how you view the world?
Man, that's an excellent question. And for those watching, Michael's questions are always really good, and I've got to think about them.
Listen,
Uh,
you're a clinical psychologist, so I'm going to come to this. I can't. I'm the guy on the couch usually. Now you're the guy on the couch, so
yeah,
you get
right.
you
Yeah,
get a taste of your own medicine.
that's right. Well, I mean, one of the metaphors I live by is that all we are stories.
Mm,
And those stories are always about other people. I think it was David Hume when he was dying. One of the last things he said is he looked up at some of his loved ones and friends, and he just said, "There's been so much wasted time."
mm,
And I think about that story. I think about Thomas King, the Indigenous writer out of Canada, who's told the stories of the First Nations people, and how those stories also are about how you relate to one another in the
right.
human experience. There are many other examples in the humanities that I really obsess over when it comes to synthesizing that into business plans, into
Mm,
how we handle the interactions of a digital interface with human beings, how we think about physicians and the lives they lead now, and the archetypes emotionally that they encompass and what we can offer for them so that they can get out of the corridors of medicine and then be the ones leading the change into a corrective space where I don't know if anyone would argue medicine and healthcare needs
Right.
to go. My first sort of obsession with human beings and how people interact, I don't know if I could really pinpoint it, but one thing that has been constant with me, and people who are close to me will know this, is for a long time I've been really into how humans interact in like the grocery store. So I was obsessed with food as a child. Used to steal salads, at school, and that was kind of a hard thing to be disciplined about since it was a healthy food. No, the kids weren't eating it,
Hmm.
but I was just loved food, loved all of it. And I remember being in the grocery store and thinking to myself, why do they put the produce here? Why are the prices there? Why is the color packaging as such? Why
Hmm.
are there so many varieties of these types of chips or spaghetti sauce or pickles? When I went to grad school, one of the 5 times I went, I was studying a lot about human interactions with product in a consumer psych kind of way. And I used
Yeah.
to really like to go to Costco. And at the time, the person that I was dating thought I was absolutely out of my mind, which still might be true, but I would go on Saturdays to Costco, not to buy because I had no money in grad school. I would go to watch people, and I was obsessed with how they wandered, choices they were making. I would kind of sit and go to different sections, pretend to be looking at things and then watching people. I was a psych grad student, so it wasn't all that weird. And I still use a lot of that now in the consulting that I've done and also the work I'm doing with Tessellate. Did some work along those lines with Elevance and
Mm.
how does someone interact with a healthcare app, for example? And how do you use modern tools like AI to put beneficiary choices in front of them? And what does one choice compared to someone else do to another person who's not like them at all, in comparison with other choices you can have them make? What we like to call choice architecture.
Right.
How we choose is also the stories that we tell. So, my obsession with the human interaction is the stories that humans tell each other and ourselves that ultimately boil down to what you're pulling off the shelf, or in the case of Tessellate, how you're signing up for something that will change the trajectory of either your evening, your day, or your life.
You know, it's so fascinating that you spend time because people always mention like me being, being in New York City for a while. You go out to people watch. To
Yeah,
me, when you think about clinical psychology, it does require listening in the silences, right?
yeah.
So when you think about that concept, what's like a truth about healthcare culture that you've witnessed that no one really wants to sort of say out
Oh,
loud?
man, this one goes deep. I'll pivot on that. I'll take the politician's answer and answer the question I wish you asked me. I do
What's the
think,
question you wish I asked you?
oh, what is like a behavioral or emotional truth in healthcare that helps it get by in an important way that maybe isn't focused on enough? And one
I
of
mean,
the answers
it's
to
what?
that,
It's your episode. It's your episode, so you can answer that question.
well, it's related to your question, which is intuitiveness is, in my opinion, sort of like um, it's somewhat of the force multiplier to taking care of patients. And I say that because it's asymmetric to the world I live in, which has been data, machine learning, AI. What's the empirical argument for the design choice we're going to make that faces
Mhm.
the patient or the consumer? If you look at like famous diagnosticians, Tinsley Harrison from UAB School of Medicine in Birmingham, Harrison's book. There's this incredible sort of intuition to the diagnostic. What do I think
Mm,
is happening here? How does this interaction with the patient make me feel? But I also think it's true for teams in healthcare. And that's where I think the intuition sort of trait and skill, i.e., listening to it, not really developing it, just listening to it, strengthening it,
mm, mm,
can change how teams interact. How is this team interacting, and what's the impact on the department, on the patient room, on the outcome of the chronic disease we're trying to manage? I think that's a comfortable truth, not an uncomfortable truth. Humans
mm.
are really, really good at that. But
Yeah,
a lot in our training, we're told to quiet it in lieu of the spreadsheet. I think a lot of physicians would look at their intuition about where they are, how they're interacting, the influence they have over healthcare nationwide, perhaps globally, and
right.
they would intuitively agree that it just doesn't feel right. And I
Mm,
do think that that is the impetus for a lot of change.
hmm. Can we go back a little bit?
Sure.
I wish internally I was an Eagle Scout, right? Can we talk about becoming an Eagle Scout? I mean, I know it's not just about badges and stuff. It's really
Yeah.
about character.
Yeah.
Like what did that process from going through it like carve into you, like
Yeah.
etch into you that you kind of still carry in your sort of your leadership today?
The ultimate resource is yourself, being prepared for what's to come in front of you. And
Mm,
also, when you think that you're at the end of the trail, you have options that you can create. And you have humans next to you that can create those with you, and therefore builds a resiliency, a stick-to-itiveness, and sort of a Angela Duckworth kind of don't give up attitude that
yeah.
pretty much you can handle at any time. I really do believe that young men and women should be involved in scouting because it teaches them to slowly molt out of adolescence and assume and inhabit a mature, adult, independent, conscientious way of thinking about their life,
Mm,
including connecting to community. And if I could be on the soapbox here, I think the country we live in needs that more than ever. You're
mm,
not just by yourself, and you can create the future because it is yours. And it starts with people that are in the community you're in. The proximal
yeah,
distance about your world is the life that you lead. And if you don't have a positive influence on that, and you're not a part of it, then you are partly responsible for its degradation. So that's what it taught me. Be a community leader, be an independent thinker, don't give up, use your resources, connect to
mm,
spirituality, and life unfolds in mystical, important, and predictable ways. Was it Roosevelt who said, or maybe Patton, um, uh, something about like success and those who are planned are typically highly correlated. There's a better quote than that, but
yeah,
it's
yeah.
funny how people who are successful have a plan and also haven't quit. It's not really a probabilistic outcome. It's predictable. So,
If we had your old scout leader here,
oh
would
yeah.
he share any interesting stories
What about
about
me?
you?
Oh my
Yeah.
God. I mean, two things. Jimmy Walsh is his name. I'm actually still in touch with him. He was a West Point grad. He's a
Yeah.
veteran, Army Ranger, I believe. So, respectable guy, taught me a lot about self-respect, discipline, preparedness. Um, uh, he would probably mention how I would cook and eat on the trail and out on the campouts. There are some other stories here that aren't probably safe for work that boys get into out in the woods. Um, I do think he would be highly complimentary with me, and he has been, about the maturation process of getting from, entering at 12 years old and then leaving at 18 with Eagle and what it meant to go from adolescent to young man,
Hmm.
which, you know, something that he would share is that passage isn't easy. There's some accountability and a lot of humility, and then acceptance of, not everyone's going to take care of you forever. In fact, part of the last
Right.
4 years of living in your mom and dad's house is getting to a place where they don't have to anymore, which is, frankly, the most respectable thing you can do for your family is prepare
Mm.
yourself to live a good life because of their help that they gave you, however they gave you that. Whether you come from
Right.
rich family or lower middle class, impoverished family, doesn't matter. If that
Right.
family was intact and they tried to help you, the best thing you can do for them is live a good life. And I remember those lessons from all the Scoutmasters. We had great Scoutmasters. We had pediatric oncologists, dentists, attorneys. I was very, very lucky to be around
Yeah.
educated people, but also people who had done things that required not quitting. So that model I had, that was luck. The other part was I listened to it. That was also luck that I was sort of just made that way.
Mm. Yeah. So this notion of not quitting, I'm not, I don't quit things. I typically do things for consistent periods for long batches of time. And I just tell people like, I'm just too dumb to quit. What do you think about that?
Not quitting. I do think that there's wisdom in quitting sometimes,
Yeah.
but not until the resources have been exhausted. I mean, there's that famous
Mm.
painting. It's a comic, really, and it's two guys escaping from like a prison. It's like very Count of Monte Cristo, and it's like two
Yeah.
tunnels
Yeah.
going this way, and the guy on the bottom quits. His shovel's down, and the other guy, like maybe 2 more feet, his whole tunnel opens up onto a beach. And the lesson there is just don't quit. You could almost be there, right?
Yeah.
To the Elysian fields. So there are times though that you're hitting granite.
Mm.
And there is wisdom in changing direction. So no, I don't think it's always good to never quit. I do think that the first policy should not be quitting. Maybe
Mm.
recalibration is a better word for that.
Mm.
Reorientation of your maps. If the topography is wasting your men and you can't get to the end point. Um, but most of the time, quitting is, for losers.
Let's let's switch gears for just a second. I want to talk about Tessellate. Let's talk
Yeah.
about the origination of the idea, the evolution of it, where it stands today. Like, let's share with the audience a little bit about that because I want to kind of make that sort
Yeah.
of the main point
Yeah.
here.
So this started way before me. So this started 4 or 5 years ago with a product, and that product was a healthcare personnel analytics product. I wasn't anywhere around this. I was working in other parts of healthcare with Ionian, doing go-to-market strategies alongside awesome firms, right? Amazing
Hmm.
Fortune 100 firms. Really lucky to do that. But the platform exited, was bought. And I had an opportunity to meet with one of the contemporaries of mine in town here in Nashville. And he said, "Hey, did you hear about this exit that this personnel platform made?" I said, "Yeah, it's amazing. Like, what's the play there? Like, what's the valuation?" And, unsurprisingly, data has this wonderful way of creating value if you find inferences that are valuable.
Right.
And to know where clinicians of all sorts, physicians were practicing, who and where and what they were seeing, and what kinds of organizations, it's really valuable. And it's about, I guess, beginning of last year, we just started having coffee, the occasional whiskey, and we just started sort of riffing, like, what would you do with this? What would you do with this? Um, and we came up with an interesting layer of tech that we would layer on top of that or integrate into a tool like that to find inference
Mm.
and therefore a voice. But to whom? And we thought very deeply about where healthcare was currently situated and where it's headed
Right.
and where the institutional knowledge of medicine resides, which is in many places, but it's in the people that we tell the stories about that ultimately, put the needle into the arm. That's where it
Right.
is.
Hmm.
Caregivers. And we thought, how could we give voices back to physicians if they were going to lead a change in the
Hmm.
delivery of healthcare that reverberated not just in the healthcare organizational corridors, but the capitals of the states, the country, and ultimately the public health and community influence that physicians inherently have because of the scarce, rare nature of their knowledge and mission that they got
Hmm.
into med school in the first place, which, by the way, is a very difficult thing to do. And we landed on, we would build what ultimately became Tessellate, and create sort of like a reverse recruiting platform. For a while we didn't want to call it recruiting,
Hmm.
because
Why not?
it's not really recruiting. It's an ecosystem where physicians join, and then the enterprises that we end up connecting to, it automates matching for both clinical opportunities, whether it's full-time placement, freelance, or locums or gig, and non-clinical work, pharma, life science, tech,
Hmm.
legal in some cases, because physicians were telling us what's out there. You know, we have what we think is not a closed data platform. It's an open data platform for physician members who join Tessellate, which is free, by the way,
Hmm.
so that they can get a dashboard that shows them here's all the things you would qualify for. Here's the match rate, 88%, 95% accuracy for what you've been trained for and what you want, including geography, unattached call, commute times,
Yeah.
hundreds of criteria. And it's sort of this passive slash active way to get a sense of all the information that's out into the world where a scarce resource like a physician can leverage his or her time and mission.
Yeah.
And we did a lot of tinkering on the business plan. We had a lot of experts look at what we were doing, mostly physicians, by the way. And we've honed it and we've finessed it. And now we've launched it. And it's a way for physicians to find opportunity, both clinical and non-clinical, to
Hmm.
leverage a skill set that's rare and scarce, that will end up, in my mind, changing everything. We're really on to something. We've got a lot of momentum, incredible fervor. I'm meeting with physicians across the country. I'm calling it the barnstorming tour. And I'm just meeting with every physician ever and saying, what's wrong out there? What's right out there? How do I build this for you and your peers? How do I reach you? What do you
Yeah.
need? The answer is in their stories. So
Well,
that's what
yeah,
that's what Tesla did. Yeah,
it's fascinating that you're going on a listening tour. That's what you're doing. You're
exactly.
going on a listening tour, and you mentioned recruitment, but it's people always talk about, hey, we've got a talent shortage problem, and it's like, no, no, actually, it's more around like talent alignment.
Yeah.
So what this really is really around aligning things that are important to physicians. So just maybe just as you're going on your listening tour, imagine you're in a, maybe you're walking into a room full of skeptical doctors. What it, what is it that you'd say to them to maybe ideally put them in a different frame in under a minute?
Oh my gosh, that is a really great typical Stamatinos question. Um, I might say something to the regards of, I'm not asking you to change where you're currently practicing, but what I am asking of you is to consider what you would do if you knew all the possibilities where you could practice and who you could influence. And I want to show you that.
Hmm. So if
So tell
Tessellate
me what
was
that
meant,
is and let me listen to you.
yeah, yeah. So
And
I mean, so if
the
Tessellate,
data is coming in, right? Like we've got enormous. Like, I mean, we're in the age of AI, machine learning. I know it's a lot of people have puked on the party for AI, right? But the enormity of data that's available that we've plugged in, is a game changer. It's an absolute game changer, and I can stand by that and be really proud of that. Where I can speak to someone who's just out of residency and they can say, I didn't take this job because the organization wouldn't even tell me what the call schedule was. I just wanted to know the call schedule. Or someone
Mhm.
else who said, I'm too afraid to ask questions about OR time, about a particular procedure that I want to be practicing because I thought they wouldn't hire me or let me join the practice if I pushed too hard on that. What we're developing is a veil lifter where you can see all of that and you can stay anonymized while you do it and not fear rejection and also help make the right choice. One thing that I say a lot is the most important decisions that all of us make in our lives are made with the least amount of information. The job you take, the person you partner with, the house you buy. Physicians make diagnostic decisions on a lot of information, plus their intuition, as I said.
Right,
Why shouldn't what they do with their career or a role be any different, and why would they accept any less? Now, when we present it in this way, I literally am 1,000% on the phone. When I speak to a physician and I say, I don't want you to change jobs now. If you enroll, I'll just show you all the things you can do. And one of those is not changing jobs and doing something remote with a tech firm, a pharma firm, a law
yeah,
firm, 10, 15, 20 hours a month, just to add some variety and scratch an itch for you. You wouldn't have 20 hours a month to find one of those roles. It would take you a year, 6 months, maybe longer. So
yeah.
we do it for free and we put it right in front of your face. Yeah. I'm really like, I'm proud of that. I'm excited about it. We've got a great engineering team we're working with. We've got great leadership. The physician advisors, I mean, they're my friends now, which, one thing that's true in the entrepreneurial and startup space is you got to be a friend to make a friend. You give a lot,
That's
right?
right.
Because the return isn't about the monetary. It's really about, is this possible? Did something change that we needed to change? And was I a part of that achievement? That's what I
Yeah.
see over and over again with our advisors, is they're more obsessed
Mm.
with, can we get to the success point and make the change and be missional? And we don't really talk much about anything else, to be honest. It's about
Well, I
relationships.
mean,
It's about getting there.
eh,
Yeah.
we're going to talk about relationships in a second. But you mentioned something earlier that I just kind of been stuck on is you're talking about having lots of data and
Yeah.
algorithms and making decisions off of that. And at
Yeah.
the same time, it's like you're a psychologist, you're a clinical psychologist that's rooted in empathy.
Yeah.
Like, do those worlds ever clash, in inside of Tessellate?
I mean, you mean me focusing too much on the data and not on the mission, or
Well, just like in the fact that you like people. I mean, how much of it is data? How much of it is intuition, gut? Is
um,
it gut, data, gut? Like,
yeah.
like
Well, the
does that does
guts, the
that
guts of
ever
the
kind of go at
platform.
odds?
Go ahead. Sorry to interrupt.
Does that ever like just clash up against one another? Is what I'm really asking.
I think
Those groups.
conceptually, but I mean, I noticed those two concepts hit when I'm sitting at a table with physicians who have this incredible education and experience and training, and I have a feeling like my of aching that they
Hmm.
are being vulnerable to tell me this stuff. Like that should have, I mean, the idea that they have to shade this at all is a driver of empathy.
Right.
And it's a class of people. I think a lot of times people are like, I don't feel sorry for doctors. Why should I feel sorry for those guys, or girls in that case? And I don't think it's so much feeling sorry as it is a bit of a head scratcher that they're giving and sacrificing for the healing of others.
Hmm.
And they don't have the same access to information, data, control, knowledge, peace that might even make them better at what they do and help them scale.
Right.
That's where, if can answer that question, that's where it hits a lot. Now,
Mm.
burnout and turnover is an empirical substrate of that empathy, to be honest.
Mm. So
That's
let's say we fast forward 18 months from now and we're
okay.
just kind of chilling, having a chat.
Sure.
What's like the moment that's going to make you say, look, Tessellate has arrived.
Um, I wonder about the timing of it, but it'll be when I catch an ear or an eye of someone speaking or writing about Tessellate and the benefit it brought to something that they're involved in or connected to. That will be, that might be a little bit of a mind bender for me.
Mm. It's
That
funny
would
because I
be a
was actually
dream, be a dream, you know.
I was having pizza yesterday with a
I love
friend who
pizza.
came from out of town.
Where? Pequod's?
No, Moretti's.
Okay.
And his colleague came with him, whose wife, future wife, his fiance, happens to be um, a resident at Vanderbilt.
Oh, okay. Wow.
And guess what? Brought up Tessellate.
No.
Yep. Yeah.
Okay. Well, put me in
Yeah.
touch with her or him.
I got you covered, dude. Already, it's
Okay.
in
Hey,
motion. I'm just telling you.
what service?
Listen, ENT.
Okay.
So let's move for a second because you've seen so much, Matt, and you've been to a lot of different conferences. You've keynoted a bunch of stuff. What's like the most ridiculous AI is going to solve everything claim that you've heard at a conference?
Okay. I have two. I'm going to start with a retail establishment. I'm not going to name it,
Yeah.
but nor the product. I walked by an aisle somewhere and a toothbrush was advertised as having AI in the toothbrush. And I thought this feels a little bit top of market. I'm not really sure who's taking their AI output to the dentist or, registering this information about how good or terrible they brush. But I thought, I mean, I love the concept, but I don't know if the consumers really want home care being advertised back to their, dentist about maybe how they don't floss enough.
Hmm.
Um, the other one, I hear a lot of Asimovian claims about what AI is going to do. It's almost this like metaphysical storytelling time about what AI is going to be capable of. We're going to forecast onset of type 2 diabetes and then cure it. We're going to totally alleviate anxiety and depression. AI's enormous data synthesis possibilities will allow the systemic difficulty of the consumer to eat more nutritiously and therefore not ever get type 2 diabetes. Any of that stuff, I sit back and just kind of think it's great cinema, but it is wholly and completely devoid of the most important part of the AI revolution, which is humans still have to make a change. They still have to consider the possibilities and then habituate that.
Mm.
And healthcare is not like somehow just going to show up and like emerge out of the water like a fish and grow legs and become a tiger. It's going to be a slow incremental change that AI brings that will give us the aha. In fact, it'll be some of those things that we might not have anticipated really had the best benefit. Now, some of the best work I've seen has been with imaging. Some of the best work I've seen is with how do you scale, clinical teams on inpatient levels with smart hospital hardware. That's proven itself. Talk to Stryker about that.
Hmm.
Um, I think using AI in any omics sort of platform, I think failed clinical trials is a place where AI might absolutely be a game changer for us.
Hmm.
So,
Hmm.
therapeutics, delivery, staff shortages, imaging and radiology, other diagnostic categories that have a little bit less variability, which in
Hmm.
healthcare, it's always a lot of variability. I think those are your realistic, like,
Right.
next steps. But beware of the man or woman on stage with the sparklers who makes the Batman-like claim for AI. Like it's obviously not real. I am a realist with the AI machine learning world. I've seen a lot, I've advised a lot, I've been fortunate to understand it because of the experience, which wasn't on purpose. It was just accidental. I got asked to help with a product, and then next thing you know, I'm in that world. Um, there are lots of weeds in the
Yeah.
AI product. not a lot of flowers. The
Yeah.
flowers will be game changers. And I think the other thing that I like to tell people is, don't think about this as something standalone.
Yeah.
AI will be integrated into products, services, devices. And in maybe several years from now, we won't really talk about it like this because it'll be a part of it. And we've seen that happen. It's sort of like a treadmill, right?
Mm.
Big data. Ah, big data. What's big data, right? Line someone up who's going to tell me what big data was. Grab executives out of their offices that are CXOs, sit them down today and say, why did you buy this AI product? What is it and how does it work? That's not necessarily their job, but there's probably a few people in the enterprise who can
Right.
speak to that very well. Um, I want this to succeed. I would just like to say I really am a huge like proponent of it. Um, I really like the idea of us staying in lockstep with the realities of it and not really like falling in love
Right.
with the Fantasia-like fantasy of it all. But yeah, I've seen even more ridiculous than that. It's not even worth bringing up here. But anyone listening to this, that
Mm.
question, I'm sure everyone in their mind's like, ah, yes, this one time,
Yeah, yeah.
So
I just
good
needed to get
question.
your
Thanks,
take
man.
on it, just because I know you've seen a lot of stuff. You mentioned something about relationships and advisors that have turned into friends, but when I think about innovation, it's a relationship sport. Healthcare is a
Yeah, that's
relationship sport.
great. Man, that is awesome. A relationship sport. That's
Yeah,
fantastic.
for sure.
Yeah.
For sure.
Yeah.
So when we talk about human beings, I talk about building relationship equity, right?
Yeah.
Um, who's transferred relationship equity, to you at a key moment? And I guess how did that sort of change your path? I mean, that could be for Tessellate, it could be for your career. Maybe just think about maybe someone you want
Yeah.
to shout out in that
Immediately
instance.
have an answer for you. Um, I got invited after my PhD to the Harvard Club in Manhattan for a conference. That conference was on behavioral economics. So some of my heroes were there. And I hate to say that word heroes. I was told once in grad school not to tell other academics that they're their heroes. But when you've read all their journals and papers and you mimic their lecture style, it's kind of hard not to say this is someone at least I looked up to. But, Cass Sunstein was there, who was advising President Obama at the time. Samantha Powers from the UN was there. Jonathan Haidt, who does excellent research on young women and social media. In my opinion, he's really saving young people and bringing awareness to the dangers of like the digital medium. Um, Voss from Penn, David Brooks from the New York Times. I mean, I could go on. There was just
Yeah.
like just this. I mean, Richard Thaler, who later won a Nobel, was there too, right? Presenting and hanging out. I was wide-eyed, right? And I was at the Harvard Club, right? So there's alumni there that are it's a wonderful brand and also a great community. They help each other and they're smart people that go to Harvard, right? I learned a lot that day. It was at lunch. I went late to lunch because I was intimidated to be there. It was just not long after grad school and my PhD, and I sat down at one of the last seats at round tables. I was sweaty and I mean, really, it was in my head. It was an absolute anxious wreck to be around these people. And
Imposter syndrome.
oh, beyond. I mean, like beyond. Um, and I'm going to leave this person unnamed for this, but a presidential advisor, very well known, oftentimes on television. He sat next to me, and he said, "Hi, I'm so and so. What's your name? And what are you doing here?" Right? Because it was invite. And so I said, "Oh, man, Matt, and I just finished my PhD a couple years ago, and I studied, psychology, and I was obsessed with human decision making and, emotional instability as a function of that, and blah 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 blah." And he goes, "Well, where'd you do that?" And I said, "Well, just Alabama," and kind of aw shucked it and dismissed it, which I shouldn't have done. I was just intimidated by the Ivy League brands around me. And he said, "What's the difference between your PhD at Alabama and mine at Harvard?" And I said, "What do you mean exactly?" You know? And he said, "What'd you study at Alabama that I wouldn't have studied at Harvard if we studied the same thing. And I said, not a thing. I read all the same journals and all the same training and all the same requirements, you know. And he said, that's right. But the difference between you going to Alabama and me going to Harvard for my PhD was when I graduated, my affiliation network was so different and so useful and bigger and stronger in where you're headed. My advice to you is to affiliate with as many people in this room as you can and build a network from Alabama and stronger, synthesize with all the people in here, and it'll absolutely change your career. And then he got up and he went and sat next to Richard Thaler, who later, gets a Nobel. And I never forgot that. I think I started my podcast after that. I told myself I'd write a book. I set rules on LinkedIn and outreach where I told myself I would try to reach out to 50 people a month to see if I could get them just to meet with me for 10 to 15 minutes because I like what they did, which forced me to research what people are doing and do I like what they do.
Hmm.
That was, gosh, it was 10 years, a little over 10 years ago now, maybe about 10 years ago. No, 9 years ago. And he was absolutely right. It changed everything. It got me invited into rooms that I probably never would have been invited in. I got swings at bat that I didn't think I was going to get into again. I had left the medical school, I had left Deloitte, and I thought I was going to do it on my own and hang my own shingle. And his advice single-handedly changed how I operated then and has only accelerated into now. And I really look at work and what we're doing as community building. I'm building a
That's right.
community. And one of the things I say to people a lot when I get off the phone with them or an email, if I'm meeting them and if it's a strategic connection, I look forward to finding out how we can help each other. And I mean that. And I learned that from this small little piece of knowledge who happened to be former presidential advisor about what I should be doing in order to make the case for myself, which, as we talked about earlier, had nothing to do with me. I'm a part of it, and it had
That's
to do
right.
with my effort, but it had everything to do with building a community, which is how things get done. One of the guys I work with is one of the best team builders I've ever seen. The first time I met some of the folks that he was going to put on this team, I thought he was out of his mind. Love you all, Tessellate, but there was just a few like, I'm not sure how these folks are going to fit in here. Months later, all made sense. I think
Yeah.
he's one of the best community builders I've ever seen. And I am not so bad myself after the empathetic impart of knowledge that, might have taken someone 50 years to get. I got 9 years ago. And I listened to it like I listened to my scoutmasters. And it's been a game changer for me. I think a lot about advice you can get that accelerates mistakes earlier in life so that you can avoid the second ones.
Yeah, that's amazing.
If
A
anyone's
lot of
listening
deep
to that,
stuff
get as
there.
much of it as you can. Yeah,
A lot of deep stuff right there. I mean, it's a physician community that you're building, no
it is a
doubt.
community.
So if you could stand in front of the vast physician community that happens to be in America right now, what's the one message that you'd leave with them?
To the physician community,
Right.
um, whether it's Tessellate or any other platform, get your information and your knowledge out of the corridors and leverage it in an aggregate way to get the changes you all want. That's what I would say. Start thinking about your communities outside of the organizations that employ you.
Definitely.
Mhm.
Definitely. What's the best way for people to kind of follow Tessellate, follow the journey? I know that you guys are really active on social channels, but maybe just give us a little bit of sort of a commercial so that, and we'll put the links in the description,
Sure.
in the show notes and stuff people can follow.
Yeah, I mean, we're going to be on most of the socials, so Instagram, Facebook, um, LinkedIn is going to be a big one for us. We're starting up a newsletter. I've got a YouTube channel and podcast that I'm going to brand as Tessellate. I have another podcast that's done well, but we're going to build one just for Tessellate for these kinds of conversations with physicians to tell their stories. You can go to www.t8health.com tessellate.com. You can read a lot about us. You can sign up if you're a physician. If you want to go to LinkedIn and have a meeting with me or get connected to me, reach out. I love hearing from people. And I will do my best to reach out and talk to anyone. I also unabashedly put my phone number on LinkedIn and on the website that you can just call me. I've had 5 phone calls today, 5 messages, and I send them to the team and we respond to every single one of them. I
Yeah.
don't think I'm leaving anything out unless Michael, you can remind me. Oh, yeah.
No.
I'm gonna go on all these conferences. I'm going to
Yeah,
AOA,
you're going on a listening tour. Yeah,
AAO.
you're going on a big
Any
listening tour.
specialty conference will likely be there. I'll likely be there, starting with the American College of Surgeons, Chicago. We're going to the American Osteopathic Association here in Nashville at the end of this month. I also put a call out for dinners. I will pay for dinner. 10, 20, 30 docs in your city, whatever restaurant you want. You call me and you say, "Matt, I want to hear about Tessellate in person. Get over here." Well, you've got it. I will come to your city. I will pay for the meal, and I want to hear what you have to say about what I'm doing at Tessellate and what you think we should be doing that we're not. And also join up, give us a shot. That's what I would
Amazing.
say. Yeah.
That's phenomenal. So there's a few things. First off, it was amazing to have you come on the show today. There was a
Thanks for
few
having
things
me.
that stood out to me in your story. Sort of goes like this. It's a thread. Psychology taught you how to listen. Scouting taught you how to serve. And now
Mm,
Tessellate is basically giving the agency to physicians that like they deserve. But what really stood out to me is that you mentioned that everyone has a story. You want to listen to those stories.
yeah,
Well, the most important story is not the one that you tell others. It's the one that you tell yourself first. And if
that's
you
right.
actually believe that, like, you being worthy enough to be in the Harvard Club and to be in that sort of
Yeah.
environment, that was really powerful. So for those, if you're tuning in today and this conversation moved you or challenged you or made you think differently, please share the episode, like it, comment it, like that, take action. And if there's a topic that you want us to explore, or if there's a leader that you want to hear from, drop me a note, leave a comment. I do read them. So this platform, it's not just content, it's actually about community. And so I love that you brought up community a few times. So
Yeah.
thanks for listening. Keep building with purpose. And, we'll see you next time on the Advancing Healthcare Innovation Show.
Thanks for having me, Michael.
You bet.